So there are about 23 million nurses and midwives around the world. They comprise half of the total global health workforce. We know that the nursing workforce will be absolutely critical to addressing the big global health challenges that we have. Infectious diseases and outbreaks, non-communicable diseases, the fact that we're all getting older as well. Nurses are going to be central to providing care, support, prevention, keeping people well for as long as they can. But our nurses are under huge pressure in many places in the world. Shortages, not enough staff, increasing number of patients, often only short times to see people as well. So we need to do much more to recognise what nurses do, but support them in the workplace to make sure that there are enough of them, they've got support, they've got education, and critically that there are enough nurses in senior leadership positions to make sure that the voice of nursing advises and informs our politicians and our top level policymakers. So the International Council of Nurses is the organisation recognised by the World Health Organization to represent the voice of nurses. And of course, when the World Health Organization meets the leaders of all of the world's countries, the health leaders come to those meetings. So a key thing that ICN does is to advocate for, make the case for nurses at those global meetings, to show the world's leaders that if you want to address the health challenges, you have to have nurses to be able to do that. But the other things we do is to produce documents that showcase what it is that nurses are doing in many countries to deliver care in often new and different ways. International Nurses Day every year commemorates the birth of Florence Nightingale, and we put out publications and resources that show the job that nurses are actually doing day to day in practice around the world. In many countries, the nurse will be the only healthcare professional that a patient may see. And they're not just dealing with healthcare issues, they're often dealing with issues to do with people's education, their housing, their employment, their family situation. And they're helping people with both mental and physical health problems. They're treating the whole person. So we bring that to WHO, to the other international organisations that work, for example, looking after and caring for migrants and their health as well. And then what we also do is to highlight why investing in nurses is not only good for people's health, but it's good for the health of economies. Investing in health services, investing in nursing means that our economies will grow and prosper because we're keeping people well, we're keeping them at work, we're keeping them away from hospitals, we're keeping people happy as well.